primi per Denk. Sono questa fase del nostro passo. Please.
Thank you very much for the opportunity to introduce you to our documentation system, and if later there are some questions, I would love to discuss it with you. I want to start with some questions to you, questions you might have when you are in the position to decide whether you want a documentation system or not. All these questions you, I'm sure, asking yourself at the end, is this investment for a documentation system worth it? Our company has been founded in 2000, and we are working for more than 25 years, very closely together with Professor Nicolaides. And our system was part of the success of fetal medicine worldwide. We are seen as the international market leader in obstetric and gynecology. Our company is quite small, it's only 30 people. We are based in Munich, very close to the Alps. You're invited to have a look at. And we have partners worldwide, even in Romania, and our program also supports Romanian language. We have more than 70 countries, more than 1,500 customers all over the world. And most important, we support more than 20,000 so-called FTS documentation systems, which are distributed free of charge. We donated it to Professor Nicolaides to appreciate what he has achieved in fetal medicine. This you can use. Some of you are sure use it. And what I want to introduce is the next step. So the step, it's not only first trimester pregnancy, it's there is of interest what happens before, what happens after the first trimester. So you might ask yourself, why should we enter structured data? At the beginning, it's very difficult to enter standardized terms, but those of you who use the FTS are already familiar with. You might be also asking yourself, why do you want to control yourself? All this quality control might have positive, might have negative aspects, but at the end it benefits you, and benefits for sure your patient. So in the summary is, that's exactly what Professor Nicolaides always says. You need standardized terms, definitions, you need a unique standard to understand each other, to know what you're communicating about. Your students need to understand you, your patients need to understand you, and you have to compare your results with others. At the end, one has to learn from the clinical experience. How do you achieve understanding? This means, firstly, you need a unified terminology. You need to agree on medical workflow, which is mirrored by a structured data entry flow. Follow-up, medical publications, accepted scientific data. For your patients, for your students, for your junior doctors, have to give them visual examples, guidelines, textbooks, and so on, which is integrated in our system. Accept the positive aspects of quality control and provide a clear reporting scheme to your patients and referring doctors. What do you need for this? You need patient demographic data to record them. You need a diary to book your patients, certainly the reporting part, drawing and imaging tools, statistic tools to retrieve the data, audit functionalities to confirm your quality, certainly the digital medical reference guides. This means growth charts, images, and so on. And an update analytics data needs to be continuously updated to keep on the state of the art. Firstly, how to enter the data. There is a manual data entry brochure. You can also transfer data from hospital or from clinical information systems, from laboratory devices, or from the ultrasound systems. You need to export your data if you are working in a big hospital. You need to export the data to the hospital information system back, and you need, if possible, to send your data to referring or to the receiving site of the doctors you're communicating with. There's a need to customize your database. There's one part which means a unique data flow, a unique workflow. On the other hand, everyone is a little bit different and has to be different. That has to be supported by customization. This is what we do. Once agreed in a basic workflow, then we can generate an examination report which follows both customized and standards. All the graphs, the images, drawing and so on, annotations has to be included. You need to print patient consent letters, patient information letters, which can be automatically generated by the database once you enter the details. The distribution of the data, of the reports, can be achieved by email, fax, internet, or by post. Audit functionalities, or using the FTS, you know how important the audit is for using and getting the FTS again and access to the risk module. But the audit should go further. It should become your own audit, where you can prove your quality and you are able to prove in case anything goes wrong. Because in medicine, everyone is a human, you can make errors, but you can prove what happened, and you can prove that you did not cheat your case. Training, that's a very important part. Continuous training of your students, but also of yourself. This we guarantee keeping our database updated and informing you what is the latest in the state of the art in medicine. Statistical analysis and data retrieval, every publication, every private analysis of your data needs the query of the database, which is very easy to be done. And everyone who is able to enter the data is able in Astraia to retrieve data. There are input extra functionalities where you can exchange your data with your colleagues for communication and asking for a second opinion. What we offer to you is there is a constant hotline support, even in Romanian language if needed. We can have access to your database by remote access. We keep language versions updated. We have nearly 200 experts who take care of translation. These are the best in your country who help us in translating. They help us also in removing bugs and keeping the system updated. What else we are doing? It's not only obstetrics and gynecology we are working on. We are extending our system to human genetics because this is an important part of the patient's history. What we heard yesterday from Professor Nicolaides about genetic analysis. This will go on. And we are also working on labor and delivery, on neonatology, and the real outcome of a pregnancy. This will be the child what you see when it is 5 or 10 years old and either happily jumping around or being depressed or handicapped or whatever. And you can see your data, what happened before, what happened during the pregnancy, what happened in the history of the patient. certainly, as you are able to collect data, not only your own database, you collect data of countries. So, for instance, in Denmark, every pregnancy is registered in Astraia, and the results are fed up to the national database. Or recently, we finished a study in Russia over 3 years with more than 1 million examinations, where they, for the first time, had a thorough overview of their data. And if you're interested, please look at our website, contact us, and let us know. Thank you very much.
I use Astraia and I think it's useful.
Thank you.
Thank you very much.